So how are efforts to repeal healthcare legislation affecting deals in the sector?
It's created a lot of uncertainty for people. It has also created some uncertainty from the banks that are lending to the sector, and so there are a lot of people, I think, that are waiting and watching. At the same time, for those who have a plan, understand healthcare, the compliance, the regulated environment, and reimbursement, there are a lot of opportunities as well.
Because Acadia's costs have already been cut to the bone, the company has exhausted its primary means of driving profits from existing facilities. We believe staffing expenses are likely to increase significantly as scrutiny from the public and regulators intensifies, because Acadia will face increased pressure to improve patient care. But Acadia has over $3.2 billion in debt it needs to service, which leaves the company little room to weather increased expenses or reduced revenues. We therefore see significant downside potential in Acadia shares.
I think being a good leader means that you set an example, taking care of our patients.
Some examples of physical abuse. His arm was broken in 3 places. He's had black eyes, wrist burns and bruises all over his body. Carpet burns have taken the skin off his face and chin.
When I visited Beth, I knelt down at a hatch in a door, 6 inches square, and I talked to my daughter through that hatch. The hatch they feed her through. That's the hardest thing I've ever had to do.
But just when so many Americans need quality care, the financial structure of treatment facilities in the United States is in serious danger. It's a perfect storm. In 2008, the Federal Parity Act required insurance companies to pay for mental health and substance abuse treatment on par with other medical conditions, creating huge margins for providers. Then, in 2010, the Obamacare mandate gave millions of lower-income Americans health insurance, raising industry profits even more. Sensing immense returns, private equity pounced, flooding the industry with dollars in the form of debt. But now, this overzealous and reckless investment, often at 30 times earnings, has vastly overvalued the facilities and also supported fraudulent treatment centers, which thrive on illegal kickbacks and built patients and insurance companies out of billions of dollars.
I know it's not supposed to be like fancy or a good time, but it definitely felt like jail.
We've investigated the many citations Sonora Behavioral Health Hospital in Tucson has received from the Arizona Department of Health Services.
Federal police have been called again and again to respond to allegations of abuse.
Nurses at Harbor Oaks say they can't keep patients safe without more help, but state officials continue to give the hospital a clean bill of health.
7 investigator Ross Jones has been digging into Harbor Oaks for more than a year now and has uncovered new allegations of patient abuse.
We need to warn you, some of what you're about to hear and see is disturbing.
Something serious happened over there. We need to find out. My son doesn't have a voice.
This father took his autistic, nonverbal son to Harbor Oaks Hospital in the hopes he'd get better. But in many ways, he says he got worse.
What I'm going through right now, I don't want any other parents going through.
Timberline Knolls, a secluded but well-regarded residential treatment center in Lamont, treats women and girls struggling with everything from eating disorders, substance abuse, trauma, mood disorders, and sexual abuse. But one of its own licensed counselors, 40-year-old Michael Jacksa, is accused on multiple counts of criminal sexual assault, allegedly taking advantage of the women he was tasked with healing.
Facility for drug addicts in Palm Beach is alleged to have recruited addicts with gift cards, visits to strip clubs, and even drugs, enabling the company to bill for more than $58 million in false treatments and false tests.
Prosecutor Ehrenberg says the arrests are just beginning.
This is not a case where a few bad apples spoil the whole bunch. This is a case where most of the apples are spoiled.
Patients at a youth treatment facility are forced to fight by staff members.
An unsafe environment full of violence. We spoke with dozens of people about what happened. Many of them didn't want to go on camera.
We uncovered more than 80 violations, including the most severe kind, immediate jeopardy. That's when a condition is so bad a patient could be harmed at any moment. We also reported on a patient's suicide and 2 wrongful death lawsuits.
A North Little Rock Child Care Center under a DHS investigation once again for possible child maltreatment.
Its West Memphis facility also still under probation after another boy was left unattended and died in a hot car earlier this year.
Attorney Joey McCutcheon has filed a lawsuit on behalf of a 10-year-old boy's family after they say he was sodomized by a mentally ill 14-year-old inside of a van.
When a company doesn't follow the safety rules of supervising and training their employees, things like this happen, and it can happen to anyone.
Puts profits over safety.
Why do you think they kept turning you down when you were asking for more staff?
Corporate profits.
Did you feel like patients' safety was a priority?
I think money was a priority.
We found that cutting staffing costs to the bone is the secret recipe used by management to inflate short-term profits.
One way Harbor Oaks has avoided scrutiny for understaffing, she says, is by increasing staff levels when hospital watchdogs are on site. The Joint Commission, also known as JCO, accredits hospitals like Harbor Oaks.
And then as soon as JCO would leave, they would give the staff low work time and send them home.
Harbor Oaks cut staffing by nearly half right after it passed its JCO survey.
Documents reveal that Acadia has degraded patient care by limiting the availability of medical professionals or hiring unqualified or improperly trained staff. Non-medical personnel, such as the secretary, allegedly have made treatment decisions. Government inspectors have even found instances where patients have died under the supervision of unqualified staff. Overtaxed Acadia medical providers resort to using chemical restraints on patients, where they deliberately over-medicate individuals for the convenience of Acadia staff.
They would rather have more money than to make sure that their staff was safe.
I shouldn't have to be afraid to go to work every day. I believe that a lot of the things that happened there could have been prevented by having a proper amount of staff.
Underspending on staffing temporarily juices profits because it's the company's largest expense, but it leads to chaos, violence, and deficient care. Jacobs first used this slash and burn model at Psychiatric Solutions. Investors sued for fraud, alleging Jacobs had downplayed the alarming incidents of abuse, neglect, and even death.
Well, you only need the light when it's burning low. Only miss the sun when it starts to snow. Only know you love her when you let her go. Only know you've been high when you're feeling low. Only hate the road when you're missing home. Only